and welcome to the Health, Wealth, and Happiness Show. My name is Patricia Martin, and today's guest is Dr. Brent Fetzer. Good afternoon, Dr. Fetzer, and thank you for being here.
Thank you. Glad to be here.
I understand your practice is in Hermitage, Tennessee?
Yes, it is.
Okay, and it's called the Natural Health Solutions and Allergy Relief Center.
Yes.
Okay, and what do you do there?
Well, I specialize in allergy relief, or basically I focus on allergy relief, and patients come in with a wide variety of conditions, and a lot of those conditions are allergy related. So we try to find out what is causing their problem and what is causing what particular substance could be causing them to have that particular condition, and then eliminate that substance.
Wow.
And when the substance is eliminated, then they won't have a problem.
We certainly need that in Middle Tennessee. We're an allergy central, right, I would think.
Yes.
And how do you do that? Do you have a certain technique or a certain way of doing that?
Yes, I have equipment. It's called the BAX 3000, and I'm able to test people for thousands of different things. And it's a computer program, and you hook the patient up to some clips, and that's hooked up to the computer. We run the program that has all of these substances in it, and the computer runs the program, and if a patient has a particular reaction to a substance, it registers on the computer. And then after you find out everything that registers on the computer, you take those substances and put it in another program and run the program through a laser over the nervous system. And when those substances come through, we're treating the nervous system. And so we run the system doing that, and when they are treated, when they come back in contact with those substances, usually they don't have a reaction to those substances.
And that substance could be dust or mites or allergies or food, or
it could be food,
pet dander, or
dogs, cats, chemicals, just a wide variety of things, medicines that people have had reactions to, and also, so we take, like I said, we take those substances and treat the patient with those substances.
Now, I've seen people that have had allergy testing, and they come and they'll roll up a sleeve, and there's slices of this and pricks of this. And is that something? Is this a non-invasive test, or is this something with needles? Or
no, that's what is great about it, because there's no needles, no shots, and no medicine to take care of the people's problems like traditional allergy treatments. And also, it's not as strict a treatment as it is when you go through allergy treatment programs that medical doctors treat people with. So with traditional allergy treatments, if you miss, then you got to go back and sometimes start over again, or go back a few treatments and then build your immune system back up. With this, you come in for some treatments, and if you go on vacation for a few weeks, when you come back, we pick up where you left off. So makes it a lot easier.
Actual permanent test, a permanent solution?
Yes.
So if I had a dog, the veterinarian said, that you're actually allergic to dog, or my pediatrician said you're allergic to the dog, you could actually treat my child, and we could keep our dog Or my child
Right.
might be not allergic to peanut butter, or
Correct. So once they're treated, then they shouldn't have a problem with that particular substance after that. So sometimes they can revert back, and we just have to treat them again, but you don't have to go through the whole program again. So that's what really makes it nice.
that's fantastic. Now, I also understand it's found to be effective in many chronic conditions, colitis, even Crohn's disease, not Crohn's disease, gluten allergies.
Yes. So people that have different chronic conditions, I'm not concerned about what condition that they have, not treating that, not treating like Crohn's disease or ulcerative colitis or celiac disease, which get a lot of people coming in that have the celiac disease.
Right.
And not treating that disease. What trying to do is find out what the body is responding negatively to and eliminating that stress from the body. So when
Wow, that's fantastic.
so when the person comes in contact again with those substances, their nervous system can handle that stress. So we're constantly being bombarded with a lot of substances, and it's your body's ability to deal with those substances. And when it can't, then that's when problems occur. So we want to eliminate the stress from the nervous system, and when that's done, then people can live a normal, functional life.
That's fantastic. Now, you went to David Lipscomb University here
Yes.
in Nashville, and you also went to Logan Chiropractic College in St. Louis. Is that correct?
Correct.
But most chiropractors that I've known, they're dealing with structural things. What made you interested in the allergy, the BAX 3000? What made you interested in that? Did you have a personal experience, or?
Yes. My son, he had eczema basically since he was a baby, and so it was starting to get worse. So, and I've worked with patients ever since I've been in practice with allergies, but was limited on what I could do, and so I wasn't getting the results with him, and so went to a doctor that had this BAX 3000 unit, and so my son was treated, and so after the treatment the eczema went away. So that interests me enough into getting the equipment to help other patients out, because it just opens up the doors because of the thousands of things that we can treat people for or look for to see what they're reacting to, whereas with traditional allergy testing, they're very limited on what they can test for. And I mean, there's only so many needles that you can put in someone. So
They're probably not. Yeah.
so I don't know of anyone that wants to have thousands of needles put in them, you know, to find out what's going on. And so this eliminates that problem.
Now, I did a little research, and I understand there are about 300 physicians across the United States that have this equipment, and it is FDA approved.
Correct.
And you have brought some people today that are your actual patients who've signed releases that have agreed to talk a little bit about their conditions and how you've helped them. Can I turn the show over to you and you introduce those people and talk a little bit about that?
Okay. A patient here to my right here, Rochelle Schoeneman.
Hi, Rochelle.
And then Justin Sturdivant.
How are you doing?
Just fine. Thank you for coming.
And Cheryl Griffin.
Hi.
And so they've been patients of mine and been through the program